Hi everyone, welcome. We're just letting everyone into the webinar, so bear with us. We've got a minute or so before start time, and as people arrive, get to a cup of tea and get yourself settled so we can have a terrific session today. Welcome everyone. We're just letting everyone into the session. Won't be long and we'll start. Hi everyone, welcome. Lovely to see you here. We'll be starting in just a moment. Just a reminder that we don't accept bots in the meeting, so unless you've arranged that early because of accessibility, we'll be dropping those off. I don't know if there are any, but just mentioning that in case there are. Sometimes we find a bot or two has found its way in. We, we've got we've got a few people who've registered but not yet arrived. That often happens. People get waylaid. They plan to be there and then they don't end up being with us. So we will get started without everyone here, and they can join hopefully very soon. So let's make a start because we have got lots of questions to answer. So welcome to the second of our two-part My Health Record webinar series that we're hosting in partnership with the Australian Digital Health Agency. My name's Elizabeth Devaney. For those that haven't met me, I'm the CEO of Consumers Health Forum of Australia. I can see, having a quick look there in the participants, there's quite a few folks that have been to our webinars before. So welcome back, folks. Welcome back. Hope you brought your popcorn this time. I'm in Naarm, on the land of the Wurundjeri people of the Eastern Kulin Nation, and I'd like to pay my respects to their elders past and present, and also to emerging leadership, and acknowledge their relationship with the land that I'm meeting with you on from today. I'd also really like to acknowledge and offer respect to any Aboriginal or Torres Strait Islander people who are attending the meeting with us today. Now, we really do love to know where you're coming into us from. So I'd like to encourage you to start in the chat now and pop in there. There's 20 odd of us. Just say g'day. Hello, where you're from. You know whose country you're on. Fantastic. It's useful to know what your pronouns are. In case you ask a question, want to answer it, want to do that respectfully. Maybe the name that's showing on Zoom is not the name you normally use for whatever reason. Feel free to let us know how to address you. That's okay too. See, we've got great people from all over the place. Terrific, thank you. It's lovely to see people from all across the country, some people from WA. Great to see you. So we just give you a moment to do that. Fantastic. A few people have got their names in the chat. So when you go in there, you should see two options too. One says to send a message to the hosts and panelists, and there's one that says everyone. Just make sure you click the everyone. Otherwise, we get your hellos and no one else can see them. Thank you, everyone. People from all over the place. Queensland. Haven't seen anyone from Ghana country. Do we have anyone from Ghana country today? No one from Larrakia country? Few folks from Wurundjeri, Ngunnawal too. Lovely to see you. Wurundjeri, fantastic. It's just really lovely to see where everyone is and feel connected across the country. Terrific. Thanks for those putting their pronouns in as well. That's really helpful. Mine is she, her. Okay. Let's move on to the next thing we like to do at the start of the meetings, which is to acknowledge consumer experience and wisdom. So we deeply respect the lived and living experiences of health consumers, carers, families and communities across Australia. We recognise the right of every person to equitable access to healthcare regardless of their background or circumstances. We value lived experience, expertise and personal commitment to consumer health advocates working to influence change, and we seek to elevate the voices of those who've navigated the complexities of the health system and partner with them to drive meaningful change. And that's why we're here, and that's why we do what we do. Many of you have used Zoom before, but if you haven't, this is how it works. You can open a chat window. There are also all these reactions you can use before. You can raise your hand if you've got something to say. You can turn on captions if you need them. Really important, if you've got a question, go into the chat. But if the chat is not working for you, if you see down the bottom, there's an email address, admin@chf.org.au. If you're having a problem, you can email admin. We'll be watching it during the webinar and we'll help you out. Thanks, folks. Let's keep moving along because we've only got half an hour today. This is just Zoom on your phone in case you're using your phone. Looks a little different, but you can do pretty much everything on your phone as well. Thanks, folks. Next one. So we've got some great panelists with us today. Some of you might remember from our previous session. We've got Koen and Kathy here from the Australian Digital Health Agency, and also Saba, who is going to be asking them a lot of questions. She's in the power position today, Saba. Yeah. And so I would really like us to get started in just a moment with the questions because there are lots to do. A couple of things, just quick housekeeping things. Yes, we'll be recording this. It'll be available to watch on YouTube. We mentioned that we don't have scribes joining us. So if you've got one of those, you'll notice it'll disappear. And this series is really about people who haven't used My Health Record maybe at all or want to get to know it. So last month, we took you through a quick tour and said, what are your questions? People sent in a heap of questions. So now Saba has a tough job of getting those answers in the next 25 minutes to all of you. If we don't get through them all, don't despair because we will send out answers. And the agency have got some great links, and during the questions, there'll be popping links which will help answer the questions as we go as well. So I'm going to hand over to you, Saba, to get the ball rolling. Thank you.
Thank you, Elizabeth. So I'm delighted to be here today to represent the voices of many consumers who have sent us questions following our first webinar. Now, the first question is, I know several people who entered drug allergies into My Health Record, but the info was ignored by the health practitioners who dispense medications they shouldn't have. Will there be better compliance by HCPs with a My Health Record in the future? Kathy or Queen, anyone can answer this question.
I think that one thing to say up front is that there isn't actually an obligation currently on a clinician to check a person's My Health Record. So it's up to the clinician and also, I guess, consumers to advocate for themselves. If they have an allergy and they know the information's in their My Health Record, a really good option is to say, oh, I do have an allergy. I can't remember the name of the medication I'm allergic to, but it is in my Health Record or it's recorded there. And that's a prompt then for that clinician to look. But otherwise, they might not know that that information is in there. They don't necessarily go and check it. So it's good to be aware of that and just give that prompt to your doctors and say, or your clinicians and say, oh, yes, I have got this information. It's in my Health Record. You can find it in there. We can't force them to look at that, but it's good practice to keep that in mind. A really good idea if you have allergies to make sure they are included in your My Health Record so that then wherever you go, that information is available, and just be aware that you can say to your clinicians it's there and point them in the right direction.
Oh, thank you so much for the wonderful tip. Keen,
yeah, I've added a couple of links as well around this in the chat. So if you want to learn more about it, you can visit those.
Perfect.
Yeah.
Thank you. So we move to the next question. Is there any plan to include provision for emergency care plans, Career Gateway, to replace the current paper-based PDF approach?
Yeah, I can take that one. Give me 1 second. So there is currently, and I assume we had a bit of a look into what they actually are. I can find that. Hold on. So their emergency care plans are currently not included in my health record. But the question is there a plan to do this? I say there is actually a lot of information that is in emergency care plans already present in my health record as it is. Did a bit of an online study on this. And for example, personal information about the person you care for, the name, age, condition, health, can actually be found in my health record. Details of any emergency contacts, including family, friends, guardians, health professionals can be there as well. Medical history and list of medicines can be found as well. It's not as detailed as an actual emergency care plan, but it is actually, a lot of it is already present. And I would really recommend people to go and have a look in my health record and see what's there also if you're a carer, and get access to your caree's record. I would recommend having a look what's in there.
Oh, thank you.
Yeah.
Yeah.
All right.
The next question is, how do older people who don't know how to use 1800 Medicare get on? You can't get your scripts. I don't like giving my phone to a stranger. And what if I move around a lot? Do I need to give all my information all the time? And I think it caters to the younger generation as well. So maybe anybody can take that.
This is a bit of a multi-pronged question.
Yeah.
Yeah, exactly.
Questions in one here. But the first one around the Medicare app, I guess to point out, regardless of how old you are, you don't actually have to use the app to access your My Health record. There is the option to log on via your computer. Of course, we know some people don't want to use either the app or even look at My Health record on the computer. That's fine. It still works in the background and is still there. Your healthcare providers can be uploading information and access that information without you ever looking at your My Health record if you don't want to, or you don't have the technology skills to do that. So you don't have to use the 1-800 Medicare app or My Health record. It can still support better care for you across the health system. So that's the first bit of that question. The other one relating to your scripts is that you can still get your scripts regardless if you don't have the app. You can get them electronic script. You can get sent to your phone as a token, so you get the little QR code on your phone. But if you don't have a smartphone or don't want an electronic script, you still have the right to choose to ask your doctor to just have a regular paper script, so you can still get those scripts. In terms of saying something around, I don't like giving my phone to a stranger, you don't need to do that if you have the paper script, or if you don't want to hand over your phone, there's no obligation to do that. And if you move around a lot, giving all your information all the time, well, if you're moving from one town and moving to live in another town, then that information, most of your healthcare information might have to be transferred from one doctor's surgery to the other. But if you have your My Health record, that key health information that's already been loaded into your My Health record will be in there, and you won't necessarily have to repeat that. So it doesn't replace the fact that if you do move to a new practice, you'll have to fill in their forms and give them your demographic details and so on. But it might mean that your new doctor there can see a whole lot of background information that they wouldn't have otherwise been able to see. So it can be really helpful if you do move around a lot, because that key information goes wherever you go.
Definitely, and that continuity of care remains intact. Now, it takes us very well in the next question, especially giving my phone to a stranger, is what efforts are being made to mitigate the risk of hackers and cyber attacks?
All right. I'll take that one. So there is a lot happening on this field, and there's roughly two areas you can look at it. There's what you can do to protect your health data, your health information, but there's also what does the agency do? And I'll try to walk you through that in a second. Here we go. So security, to start with, is a key component of My Health record, and there are many safeguards in place. Things like it's managed by the agency in line with the government protective security policy framework. The data is stored within Australia and protected by high-grade security protocols. And external software that's involved goes through very thorough technical conformance process. So we are in charge of monitoring that if it's safe to be used. The agency, as the system operator, also tests the system frequently to ensure the mechanisms are robust and working as designed. Now, other design features you can think of are audit trails, technology and data management controls, as well as security measures to minimize the likelihood of unauthorized access to the information in your record. But as I said, a couple of things that could be useful for you to do, because you can do things too to keep your data safe. A couple of tips are use a strong passphrase and secret questions to access your My Health record. You can set that all up in your account. Further, you can set strong privacy settings on your accounts and devices. This has more to do, and please refer back to the first webinar we've done around setting up a certain document access control codes, etc., to give people who cannot access. You don't want, if you have certain healthcare professionals, you don't want to access your a certain document, you can actually set that up for those documents. Further, you can also enable, well, we recommend to enable automatic software updates to ensure your device is always up to date in terms of security patches. And I'll just post another link in the chat around this topic on our website. Yeah, thank you.
Thank you so much. Yeah, that tip was really useful. Coming to the next question, what can we do about doctors who refuse to upload our records? And I must say, as a consumer, it's very common in rural and regional areas where you have limited appointment time.
I'll take this one if you like.
Yes.
So it is tricky, and I live in a rural area as well. One thing to be aware of is that My Health record isn't the complete record that's held by your doctor, so you can't expect them to upload absolutely everything. That's not really what My Health record is designed for. It's really that summary information. So the key thing that's really useful to ask your doctor, your regular healthcare provider, to upload is what's called a shared health summary, and that just captures that key information. So that can be really great to have uploaded. In terms of whether they can upload that document or not, it depends. Most general practices are now connected to My Health record, so they are able to, and they have software that allows them to upload those shared health summaries. But there are other doctors and other clinicians, say a medical specialist, who might not yet have the software that allows them to upload. So while they might say, oh no, I can't upload that, it might be because they don't have software that can talk to the system yet. That said, we've been doing lots of work with specialists to get their software. We've had a software industry offer to make sure their software can connect, and so that they can upload their letters now. And that actually happens in the background. They don't have to do anything. There's a little tick box that just says send to My Health record, and it just goes up when they write their letter. So that's fantastic, because all of that detail in that specialist letter can then be included in your record. So I guess that's the main tips, and it's always just worth asking the question, you know, and advocate again for yourself. Be prepared to say, I really want this information in my Health record. Can you please upload it for me? And if they still refuse, then that's their decision, but you can then make your decision about whether you want to keep going to that practice or not.
Thanks, Kathy. I'll keep this in mind when I make my next appointment. So the next question is, what's the best way to chase up records that have not been uploaded by the provider, especially the hospital discharge, pathology result, etc., especially if the provider has uploaded to your record?
Yeah, thank you, Saba. I'll take that one. So this is a common one. It's in most hospital settings, uploading into My Health record happens by default. So it happens automatically through the information systems that the hospitals have. The same with pathology and diagnostic imaging, especially with the new sharing by default legislation, which I think I already posted the link in here as well about. I'll do that later. I'll do it actually right now here. Okay. Because that's an interesting thing to actually point out. So yeah, with that in place, pathology and imaging reports are now required to be uploaded by law. So that's an interesting development. You generally shouldn't need to chase them up. If a provider used to upload, and this is a bit of a different angle to the question, if a provider used to upload and suddenly isn't doing that anymore, it's worth giving them a reminder, preferably when you are actually at the consult. And I know this can be tricky, but it's really worth for them to have that context, like you're there right now, sitting at their table, at their desk, and you say, hey, I noticed something. It used to come through, it's not doing it anymore. Just let them know you'd like your shared health summary or specialist letter to be uploaded to your My Health record. And your shared health summary would usually come from your GP or another primary healthcare provider, if you have another. And a specialist letter comes usually from a specialist. So yeah, it's good to know these things because then you can actually target your message quite a bit. Hope that answers the question a bit.
Oh yeah, definitely. Thanks for that.
Over time.
Now, how do I go about contacting my radiology provider to upload the scans?
So there's a couple of things relating to this one as well. At the moment, My Health record primarily doesn't include the scans or the images from a diagnostic imaging result. It just includes the report. So the report gets uploaded. The good thing about the report is that if another clinician is looking at it, they can see where you had the scans done. And if they need to, then they know where that was done. And often those radiology services will have a portal. So the clinician can go to the right portal and go in and have a look at those scans. So you shouldn't need to have to contact them to upload the scans. It's just the report. And again, as Kuhn mentioned, with the share by default legislation now, there will be a requirement for those diagnostic imaging providers to be uploading those results, those reports, and then the scans can be viewed through the portal systems that they have themselves.
Thank you so much for that. If I had previously said, don't enter into MHR, and now I want this to occur, how do I change that?
All right. Yes. So this is another one of those multi-pronged questions with two parts of, in this case, two parts of answers. First one. So if you don't have a My Health record and now you want one, that's question, I think, number one we're trying to cover here. So most Australians already have a My Health record unless you opted out. If you opted out or previously cancelled your record, you won't have one at this point in time, but you can set one up if you want that. Setting one up or accessing your record is done through MyGov by linking the My Health record service and verifying your identity. So if you want to set up a new one, you need to get into your MyGov account. Once created, you'll be able to see hospital discharge summaries, pathology and imaging reports, prescriptions, and more other more documents as the providers are uploading them. Now, the second part to that question is, if you do have a My Health record, but previously told the provider, please don't upload this, which is also a scenario we might have been in, that's a little different. So that request only applies to one instance, one situation. For example, you don't want a blood test that you just got prescribed from your GP to be uploaded in your My Health record. You can request that at your GP, and they can actually tick off on the form that it should not be uploaded into My Health record. If you forgot to do that, you can still request this at the clinic where you're getting the blood test done. Still needs to be honored. Yeah. I think that kind of covers the question. Yeah. I got a couple of links for you on that one as well.
And the next question, yeah, and the next question links us to the same thing, you know, how to set up the record. So who do you recommend to guide face-to-face with assistance in our local areas?
There's a few options that we're aware of. So quite a lot of community organisations and community resource centres have people who provide training on using digital services, including My Health record, and also some local libraries. So we've done some work in the past with the Good Things Foundation, and then they've trained community members to go out and support community members and consumers. And of course, organisations like the Consumer Health Forum have groups that can help and support as well, and advocates across the country. So I'd say reach out to those organisations in the first instance. And while we don't do face-to-face training ourselves at the agency, we do have some fabulous little online e-learning modules, which are really clear and instructional step by step, and Koen will post the link to those in the chat as well. So they're not face-to-face, but they're great field guides to show you how to do things in your My Health Record.
Yeah, thanks, Kathy. In fact, I must say that especially with the module, I asked my daughter to look and complete the module, and then she was able to set up her own record.
Fantastic.
That's really good, especially
Great.
for the younger generation.
Yeah.
So, coming to the next question, could we get health and hospital services to do a learning for this?
Yeah, thank you for that. So again, we assumed this was about hospital and health services. If not, please put in the chat what you mean by it. I think that would be correct thing to do here. But this is what we assumed was the question about. So for hospital and health services, at this point in time, could we get to yeah? I think it's a good idea. We'll just take that on notice, actually, is the question, is the answer. It's very short, it's not very great, but that's all we can give at this point in time. We work with a lot of partnerships, and yeah, this might be something we can take along in the pipeline for future. Kathy, anything to add there?
I was just going to say, I think it would be great for any consumers who are on those health service groups to advocate for My Health Record learning for their services. So that's an opportunity, I guess, for you on the who are watching today, attending the webinar, to suggest that. You can perhaps ask if they can do it.
Thank you so much for taking the time to answer some of our questions. We really appreciate your time and commitment. Over to you, Elizabeth.
Wow, how fast was that? Well done, Sarah, and thanks, team, for getting through all of that information so quickly. So thanks everyone for joining us for this part 2, and we hope the questions were useful for you, and the sessions have given you some more confidence to use My Health Record. There are lots and lots of links in the chat, and we will be putting this on our YouTube channel so you can look at it again in time. Remember that there's a lot in this, and you don't have to master it all on day one. Just use a little bit of it, and over time find the parts of My Health Record that are most useful to use and become expert in those. We have fact sheets. CHF has fact sheets. You can see them up there on My Health Record, and the agency, as you can see, have got a lot of things on their website also, which might be helpful. So there are lots of resources out there to help you in the next steps of your journey with My Health Record. We hope you leave today feeling more confident to use the record. And on behalf of CHF and also the Australian Digital Health Agency, I'd like to say thanks for joining us and have a great rest of your week. And we hope to see you at another event soon. Bye, folks.
Thank you.
Thanks all.
Hi, panelists. We're just having trouble stopping recording, so we might